I am Sharon Spurlock, and I'm really happy that you're joining us today. It's November, which means it's National Family Caregiver Month, and we are very fortunate to have with us today representatives from a national organization that focuses on caregiving that's going to tell us all about bigger issues in family caregiving across the country.
Karen, thank you so much for having me. It's really a pleasure to be with you. My name is Marvell Adams Jr., and I serve as CEO of Caregiver Action Network. We are a not-for-profit based in Washington, D.C., and we impact the lives of millions of caregivers across all 50 states and really internationally because our website, is open to really anybody where many of our resources reside. So our real mission and purpose is to be able to support through no cost family caregivers with resources, trainings, guidance, education, as well as advocacy and raising awareness. And we do that in a whole host of ways. Some of the more consumer facing or caregiver facing ones is we have a dedicated help desk where if you either go to our website, caregiveraction.org, if you dial 855 CARE 640, that will also get you to our team of social workers that help individuals that may have caregiving questions, caregiving needs. But then also, even if you go to our website and want to web chat with someone, you'll see there's a little help desk icon at the bottom right-hand corner whenever you go onto our website. And you can also chat with someone there, or you can just send an email. So whatever way is most accessible for you, but our objective is really to say to folks, if you're a caregiver, reach out to us because we really try to be a single point of entry because, you know, um, as we sometimes say, caregiving is the one job that no one was looking for, but so many of us, got hired. And that many times is something that happens, with a fall, a call that happens after someone fell down, a diagnosis, with the doctor. But either way, caregivers are most likely kind of thrown into or sprung into a situation and they may not return. And so for us, being able to have resources that are categorized, whether it's around you're a first-time caregiver, you're a long-distance caregiver, you're a long-time caregiver, which for some individuals that may have a child that's born with a developmental disability, they may be a lifelong caregiver for that child and growing into their adulthood. So our objective really is always is to make sure at the end of the day things we're doing are helping caregivers out there.
Sounds like you've got a lot of really robust opportunities. I feel like with caregiving, really the pandemic kind of shed this light on this invisible group of people, and all of a sudden it became a really big topic to think about caregivers and caregiving. And we were just talking about statistically how many people are now being identified as caregivers. How do you see the last 4 years in terms of recognition of caregivers and kind of key issues that are coming up around caregiving? What do you see on your side of the country?
Yeah. I think you really put a spotlight on one of the main catalyzing events of that, which was the pandemic. It was almost impossible for the employers to not see just how much of a caregiving role that their teams had, and just how impactful it would be if our caregiving system broke down. So when daycare shut down, when schools shut down, when offices shut down, but work continued and school continued, but just all in the same space, there was really no hiding it any longer. And it was a double-edged sword because you recognize that one, still statistically, over half the individuals that do some sort of caregiving duty at any given time don't recognize themselves as a caregiver. They recognize themselves as a loving son. They recognize themselves as a devoted daughter or sister. They recognize themselves as a neighbor that's just doing, something to help someone out. They don't see themselves as a caregiver. And so some of the things that we've endeavored to change, particularly with this month's campaign, National Family Caregiver Month campaign of I Care, of really focusing on self-identification and self-recognition, because that's the thing that has been changing and needs to change more. So one of the statistics I can give you is that historically, as you might expect, more women have historically been identified as caregivers than men. More recently, men are just as likely to identify as a caregiver as women are now. But if you ask a woman to describe what that entails versus what a man might describe of what that entails, you see that the amount of time and effort being put into that caregiving endeavor by a woman is still significantly more than what a man might envision it takes to put in, into that care. But either way, what we've seen from the most recent numbers coming out of a RAND study that was put out by the Elizabeth Dole Foundation that supports military family caregivers is we've reached over 100 million, 105 million caregivers across the United States. And we know for certain that still underestimates the number of caregivers out there. We know that we miss the mark sometimes in estimating, individuals that we were just at a Hill briefing today and heard of a mother's whose son, really became a caregiver at the age of 9 because their dad came home with PTSD after serving the military. He had two little sisters that really needed support. And the next time his dad went to deploy, his mom was coming to term with a child that she was carrying. And so, there are those pieces that are still missed out on, but we know over and over again is that if we can continue to amplify the message that caregiving can be mowing your neighbor's lawn or putting the mail on, bringing it from the mailbox and putting it at the door, to spending the night at your grandma's house because she's been falling, to being a parent of premature kids that are going to have, special needs as they develop, in their first early years, to, a spouse whose significant other has another bout of cancer. And it really is everything in between. And so for us, what we've seen change is people recognizing themselves more, but still that being a huge barrier to people actually reaching out for support.
So you talked about self-identification being part of your mission, and I'm curious why you think that's an important piece. I imagine there's more than one reason.
Hmm. Yeah. So, one of the things that we see is that, if you're putting out resources out there for individuals, that are widget makers, and someone that is technically making widgets doesn't recognize himself as that such, they're not gonna that ad, that resource, even if it's free, that person's not gonna connect that that's for them. And the same thing with caregiving, that if someone doesn't recognize themselves as a caregiver, and then sometimes it's not necessarily that they don't understand themselves as a caregiver, they think to themselves, well, that help couldn't be for me because I'm doing what I have to do as a spouse. So I shouldn't be looking for help. I shouldn't be asking for help,
Yeah.
particularly if your significant other did it for you. Well, she was there for me, now I'm there for her. So there's kind of this wall that goes up of thinking, one, either A, support is not something I should be getting, or B, if you don't recognize yourself as a caregiver, but you're doing all these different things, then you're far less likely to reach out for help. One of the things that stands out, we have a really robust Facebook community, caregiver action Facebook community, where it's a closed group. We have, a couple thousand people on it, and people post things. And, we had someone that posted a little while back and listed this long list of things that they did for one of their parent each day. And you're like, oh my God, how are you doing all this stuff? But at the end of the sentences, she said, I'm not sure if this group is for me because this group is for caregivers. And she was very sincere,
Yeah.
and it's like, if you're not a caregiver, I don't know who is. But that's really where the problem lies, in that you then isolate yourself more likely because you don't think that you really are part of that group. And so that's what we think self-identification and self-recognition, which is a part of the national strategy that was released in 2022. It was a core pillar of that strategy because when people recognize themselves as something, they're more likely to receive and seek out support.
Excellent. I want to ask one more question, and then we've got a lot of questions from our audience. And mine is really about the long-term caregivers. And one of the things that I speak to our families about a lot is the ability to ask for help, to find those you mentioned earlier, and I was thinking about it because I just spent 2 months taking care of my mother in New Orleans, and the people that come and move her trash can in and out and bring her newspaper to the door every day, those were such important people for me. I didn't have to worry about any of that. I could worry about some of the more detailed things. And I think for most of our parents that have a child of any age with a disability, they're really hesitant to accept help from outside, or even to say, how would it work for you to do X, Y, or Z? How do you support families to kind of open up to that?
Yeah, it's tough because I think the part of it is, how we've kind of become more spread out, when it comes to our families. And so I grew up, my family and I, we live in Baltimore. I grew up in South Carolina. My wife grew up in Los Angeles. And so we have zero family within, anything, less than a 8-hour drive or a 5-hour flight. And so having three kids uh was tough, but recognizing that, if you looked 30, 40, 50, 60 years ago, there would be a sense of community that would come around a family to support them, whether it was your own family by blood or your neighbors or your friends. And that's changed dramatically. The pandemic also had an impact on that as well, of kind of this kind of isolation that went into place with people. But recognizing that more and more, this notion of ensuring that people have a chosen family, that they have a recognition that the people that care and love you in New Orleans, when they drop off the newspaper and they stop by or bring by a meal, that really is a part of caregiving. Because as was mentioned with our Surgeon General, I think it's been a couple of years now, that with social isolation being a true health crisis, when you're dropping off a meal, you're helping combat isolation. When you're just making a FaceTime call once a week, you're helping with social isolation. And so recognizing that everyone that can be a part, big, medium, small, of a community for someone that needs support and care, and for a caregiver that's taking on the primary role, you really are creating that community where it's needed. Because we weren't meant to be this separated.
Yeah,
I was meant to
yeah,
be, with my mom down the street, or maybe even the house with me. I was meant to be, that the family came over, and that, there was not this frantic look for babysitters and things like that. There was a community that was around folks. And
yeah.
so I think that's what's changed, but a part of, in ways, what people are trying to get back to. Because it does take a village.
It does. I love the fact that you pivoted that from the caregiver being the responsible one to loop in people and really to encourage everybody in the community. If you have the capacity to look in on your neighbor next door, to offer some support to a coworker who's having a challenge, that is the kind of community that I want to live in. And I love the fact that Marvell, you brought that kind of to the forefront, because that's really fantastic. I'm going to go to some of the questions from our audience. They're asking if you have state chapters like the ARC does, or if you operate strictly out of Washington, D.C.
That's a great question. So we don't have state chapters or affiliates in the way that the ARC does, but what we do is we take the network part of our name. Caregiver Action Network is where we kind of bring online. And if you reach out to our help desk, either on the website or through phone, we can, and let us know what locality you're looking in, we can connect you with local resources that have, whether it's caregiver support groups, or maybe it's disease and condition specific connections, things like that. Because what we found is, there is a richness in most locations, of different types of caregiving groups, because many of them, are started because someone was a caregiver and didn't find their way, or didn't find the information needed, and decided they didn't want somebody else to go through that. And so if you reach out to us either on the website or through the help desk number, and let us know where you are, we can find you local resources that are caregiver related.
Wonderful. And they did also ask about specializing, like you do have kind of people that lean more towards veterans issues versus supporting family members with disabilities, right?
Yep, absolutely. And there's that dynamic that we can help with as well, in identifying if you have certain things you'd like to see in a group. And because many times people just want to connect with someone that understands, because it's an easier, way to perhaps unload yourself when you see that there's some empathy there already.
Absolutely. And
Absolutely.
one of our audience members commented that the gender perspective on caregiving is very interesting. Are there any things else that you see along the lines of gender and caregiving? It was very interesting, again, back to my story, to try and figure out the roles my brothers would take versus the roles I took, because there was no overlap at all in terms of our skill set or interests.
Yeah, yeah. I mean, there is. I mean, I will go as far as to say there is a sexist aspect of this. There's no really way of sugarcoating that. And recognizing also, if you want to step back and say that in, some cultural traditions, whether immigrants to the United States or just looking around the world, because caregiving is not just a core issue within the US. I mean, it is a global issue. There's no part of the world that isn't impacted by it, and in some instances, caregiving crisis that exists out there, particularly in certain Asian countries where just the population has outgrown the amount of able-bodied individuals to be caregivers. But be that as it may, understanding that there is a sense that when we're talking about caregiving in the US, we really are talking about a whole host of things that we mentioned previously, but it's recognizing that um the need for caregivers will really not go away. It's only going to increase. And so really the approach around this is a bit incremental, and being able to, we have a company right now that we're talking with that is a defense contractor, and 80% of their workforce are men. And they have these services to help caregivers. And they say we put them out there and most of the women come out and the men never do. And it's like, and their crux was, is like they had put resources behind this, but how do they reach them? And some of that is changing, and some of it's changing in the way we talk about expanding what that definition is, because it really is far more than just taking care of someone because their cognition is failing. It's more than just helping someone that's going through a bout of chemo. It really is about that connection that may happen because someone stops by another person's house to say hello and deliver a meal. So that gender gap is one that, in my opinion, will have to improve because there's just no really other alternative, because we just really need those individuals, and that sense of community will become more and more important.
I'm going to stay in this lane and just talk a little bit about legislation, because I think there's definitely a gender gap in representation. So I have noticed that there's starting to be more and more legislative action around recognizing family caregiving and putting some resources to support caregivers. What do you see percolating on the Hill?
Yeah. And so last night, as luck would have it, the House passed the Senator Elizabeth Dole act around support of military family caregivers, which really is to help bring more comprehensive resources to veterans and military families and their caregivers. But in addition to that, we're seeing, a really good climate for a tax credit of some sort for caregivers. Optimistically, conversations around what does it look like for Medicare to have a benefit for home health. Because at the end of the day, the doctor can prescribe the medication, the pharmacist can fill it, but if there's not that caregiver to be a bridge in between, medication compliance goes out the window, making it to that appointment for the next treatment doesn't happen, and that costs more to the system. And so if you can prevent a hospitalization or an emergency room visit because you you've supported a caregiver, whether that means your state program, Medicaid is paying caregivers, and that does happen in some states, whether it's a home care benefit or something that allows the caregiver to be better supported. All signs point to that that's a savings in the whole, because you are preventing individuals from being hospitalized, which is the most expensive place, but it's the place that almost always we don't want the person we're caring for to go to. It's a last resort kind of thing.
Yeah, excellent. I'm looking forward to seeing some of those things come to fruition. I feel like over the last 10 to 20 years, we've built a lot of foundational things around the business of family support and caregiving, and now we're starting to see some systems change really come to a head. And I feel like I feel really positive about some of those things. We've got a couple questions that sort of revolve around demographics, what the difference are for caregivers with the comment from rural versus urban areas, ethnicity, religion. What are some of the things that you see impacting caregiving needs and supports?
Demographically, no, I don't have anything off the top of my head regarding demographics amongst caregivers. What I can say is when you look at caregiving through the lens of older adults needing having supportive living needs, and I know that that doesn't cover anywhere near all of caregiving, but what you're seeing amongst the 55 plus and 65 plus generations is that with each decade passing, it's more diverse. And so you're talking about between now and 2040, a near doubling of the older adult population amongst Black and Brown communities and Indigenous communities. You also see an increase in the number of individuals, older adults identifying as a member of the LGBTQ plus community. And why that becomes important is, what does it look like to have the cultural competence to be able to support those older adults and understand their lives, their lived experiences, because there's some aspects of caregiving that really can tear open old wounds. We've talked to caregivers where there's a daughter who came out to her parents and had not seen them, or talked to their mom in 15 years until mom, needed a caregiver. And of course, her daughter came home for that. But that is a very difficult thing to navigate. Other aspects of it around what we can expect to see is an increase acceptance of using home care or residential or facility-based care by populations that culturally tend to have folks stay at home. So Hispanic, Latinx, Black community members. But at the end of the day, 90% of the people um, uh, end up staying at home. That's just how the numbers work out. So whether it's by choice or by necessity, caregiving, as we know it from a family caregiver perspective, really is the backbone of our care system. And the number of individuals needed really will continue to increase. But from a cultural standpoint, there is this my sense that there will continue to be more of a need to have individuals trained and competent culturally to be able to serve the needs of the various lived experiences.
Yeah, I think it's fascinating to try and be culturally sensitive as you're supporting families to make sure that you're honoring the way they want to approach it while giving good support. I'm kind of intrigued. We have a counseling student who's listening in, and they're asking about how a counselor might best support people in family caregiving situations, and what kind of they asked about social justice issues, but just issues in general. I think first of all, families are less likely to seek out counseling around caregiving probably than most anything else. I don't know if you've got anything to add to this question about supporting caregivers in a counseling setting.
Yeah, that falls right in the category of self-care, which we talk a lot about in throughout all of our resources. In almost any instance that we get a chance to talk about caregiving, so thanks for giving me this opening. We like to talk about self-care because, as they say, when you get on a plane, everyone knows, put on your mask before you try to put on the mask of the person beside you. And the whole reason for that is that if you can't breathe, if you can't take care of yourself, if you can't sustain yourself, then how can you be there for your loved one as a caregiver? And the answer is you can't. And so, one of the things we talk about is the mental health aspect of caregiving is hugely important. Trying to avoid burnout, trying to avoid situations where you are so stressed that your stress is now impacting the person that you should be giving care to. And so that counseling aspect of it, even though it may be shied away from by some, it really is a part of their own self-care to be able to juggle what something that is not going to be easy. No one jumps into caregiving and saying, thought it'd be a piece of cake, and sure enough, it was a piece of cake. There are obstacles to navigate. In addition to that, I think counselor from a proactive standpoint, being in a position to be a sharer of information. And quite frankly, we encourage folks to share the resources on our website. From a social justice aspect, we try to look at some of our toolkits and say, okay, where are the gaps? And so in mental health, we had a blueprint for caregivers of individual with mental health conditions. And so we recognized that there were added disparities and kind of layers when you looked at the Black, Indigenous, and people of color community. And so we re-envisioned that blueprint, interviewed new caregivers, developed a new blueprint, really to talk about what is it like to be a person of color with a child with mental health conditions, and how do you not only handle that, but then the system that may not see you in a way that they may see others, or how to advocate for yourself. And so that other aspect of recognizing that, caregiving is it's always humans taking care of humans. The robots aren't quite there yet, although every day they seem like they're closer. I saw one folding laundry pretty well the other day, but still, that human to human aspect of it is going to be in the forefront. And so, we have to be able to show our humanity in order to support those individuals. And part of that means recognizing that their lived experience may be something that influence how they give care, which means that we need to find tools that are going to work well for them.
Yeah, wonderful. It sounds like everybody should take a visit to the webpage, that there's going to be a lot of good resources that might help them to dig down into what they need. I see that we've reached our time, and I'm sorry to those of you that I didn't get to your questions. I'm going to just ask one final question since it's National Family Caregiver Month. You said it's important to celebrate family caregivers. Is there anything you'd like to say about that to close us out about valuing and celebrating and cheering on our caregivers?
Yeah, absolutely. I would say to you that anything that you can do to recognize a caregiver is going to go a long way. So whether that means that you have that neighbor that sees has a child that they've taken care of for 30 years, and that you can tell them how much you appreciate everything they do, or whether that means bringing them a cup of coffee, if that means posting something on social media and recognizing that unsung hero. I would be remiss if I didn't say, if you wanted to give a donation in honor of a caregiver to Caregiver Action Network, you're more than welcome to do that through our website as well. But at the end of the day, take the opportunity this month and every month to show caregivers that you see them, because that social isolation is a real factor that is so hard to ask for help for. To pick up the phone or text someone and say, I'm lonely. I'm here with mom and she's in bed, or I'm here with, grandpa and he's in bed and I'm lonely. That's a tough ask. And so just assume that when someone is a caregiver, for a quarter or half or all their day, that, stopping by or giving them a call is going to be more appreciated than you might know.
Thank you. Beautifully said. I really appreciate your time today. We reference your material quite a bit. The Caregiver Action Network, check it out. They're going to have lots of great resources for all of you. And happy National Family Caregiver Month.
Awesome. Wonderful. Thank you so much, Sharon. Thanks
Bye,
everyone for
everybody. Have a
coming on
great
today.
day. Thank you,
Take
Marvell.
care.